Some in the medical world are concerned tonight about recommendations from a newly formed CDC vaccine panel. Today, it reaffirmed people should get the flu vaccine, but it also voted to recommend only using doses free from thimerosal, a preservative that contains a small amount of mercury that hasn't been used widely since the 1990s. Ben Henry asked an expert from the University of Minnesota if this could lead to fewer people getting the flu shot. Ben?
Kevin, he fears this will lead to vaccine hesitancy and the spread of misinformation. He's not alone. Several entities, including Johns Hopkins and the CDC, have debunked allegations about the dangers of vaccines that include thimerosal. The panel, though, says the recommendation is to limit as much mercury exposure as possible.
We're going to start with a roll call.
In some of their first actions, the CDC's newly formed advisory committee on immunization practices is causing controversy, recommending seasonal influenza vaccines be free of thimerosal.
If we care about public health, we should try to minimize exposure to mercury.
Thimerosal, which contains small amounts of mercury, remains in 4% of existing flu vaccines and is used to help prevent contamination in multi-dose vials. HHS Secretary Robert F. Kennedy Jr., who picked the immunization committee, wrote a book in 2014 that falsely claimed thimerosal is toxic to brain tissue and may cause autism. What were your initial thoughts?
Overall, this is relatively a non-issue. That thimerosal was taken out of routine childhood vaccinations in 2001, and so a long time ago.
U of M professor Dr. David Boulware says that was done out of an abundance of caution following concerns, which the Minnesota Department of Health says were unfounded, adding in a statement, thimerosal has been carefully studied for a long time and there is no evidence that it causes harm. Are there worries a step like this could lead to the spread of misinformation?
Certainly, the concern doesn't really match reality. And so that's, I think, where a lot of people, a lot of physicians have their concerns.
Is there a concern it could lead to fewer people getting the vaccination?
I think that's always a concern, and I think that's just since COVID, that's been a broader concern in general. You can always talk with your regular family doctor, your pediatrician, et cetera. I think that's probably a very good source of information.
MDH also said there are many other flu vaccines already available that do not contain thimerosal, so there shouldn't be a large impact on flu vaccine availability in the U.S. And keep in mind, this is only a recommendation, but this panel does have big influence, including which vaccines insurance companies will cover, Kevin.